Kia ora, welcome to Stuff Live. I'm Rachel Thomas, a health reporter, and with me is a man who needs no introduction, Dr. Ashley Bloomfield. Morena.
Morena.
So tomorrow's your last day as Director General. You've had about 307 press conferences since the pandemic began. Yesterday, your final one ended with a round of applause. How did that feel?
Oh, well, I was taken aback actually walking out of the stand-up for the last time, and a number of the staff there from our COVID-19 team have just worked so hard over the last couple of years were there and gave me that round of applause. But I'd like to think they were applauding their work as much as they were my contribution. So yeah, it was very moving actually.
So what mark would you give yourself out of 10 for the COVID response?
Oh, actually, I think that's for others to do rather than me marking myself. I would certainly give my team a really high mark. They've just done such phenomenal work and worked so hard, harder than anyone could be expected to. Behind me as I guess the face of it in public has been such a huge team of people doing all sorts of work, and most of that will never be known to the public. But so saying, all the correspondence I get from the public, and I still get lovely letters and cards and emails every day, almost all of it says thank you to you and your team. So I think people do recognise that I was the face of it, but behind me were a lot of good people. Is it sort of a relief to no longer be the face of it? I mean, yesterday I think Pete Watson acknowledged the toll it not only had on you but your family. What's that been like for them? Well, what I would say is that my family's been fantastic support and they've kept me grounded. Home's been a COVID-free zone, no discussion about COVID, which is good. The pressure has been, high, especially at certain times. So I'm looking forward to spending more time with them and just also not having COVID in my head the whole time. And I dare say the last 2 or 3 months as I've moved closer to my end date, I've felt the pressure lifting a little with each day, and that's been good. So, of course, now we are seeing, unfortunately, thousands of daily COVID cases a day. We're hearing of people waiting weeks for cancer surgeries, GPs getting health insurance. Is that a bit of a tough note to go out on? Well, it's a tough time in the healthcare system, and we knew this was going to be a really high pressure time through winter, not just because of COVID, but of course we had a big flu outbreak as we expected early on. One of the other things is that in previous years, if our staff had been sick, often they would still turn up at work, this notion of presenteeism. And of course, now with COVID, that's no longer an acceptable thing, and that's good, but that has added to the pressure as well. I do want to make the point, though, that it's really important for us to keep it in perspective with what's happening in other countries, and they are facing exactly the same issues. But for the countries that didn't take the approach New Zealand took, there's an even greater impact. So the lists for delayed surgery are much longer. The impact on cancer treatment and even on acute care and on staff has been much greater. So I'm satisfied that we did everything we could to protect our healthcare system, even knowing that at some point we would have this really significant pressure. Yeah, and just on that, I mean, health workers are telling us the system's on life support at breaking point. Is it a crisis in your eyes? I don't think the system is at breaking point. I know that there is enormous pressure, and we do see this through every winter, that there's incredible demand. We do winter planning every year, and we've done more this year than any other year. I think that people are working really hard and that it's tough, but the challenge I think is around labelling things as a crisis is it takes agency away from people. Actually, there are things that can be done and there are things that are being done. And one comment I would make is there are more staff in the system now than there have ever been, and the increase in the last year has been bigger than it was in previous years. But that's countered by the fact that we are seeing, because of the pandemic, these additional factors playing out. We know everyone needs to do their bit to help protect the system through winter, and I'm really pleased that New Zealand has embraced that opportunity as well. So, without being partisan, do you have faith in Andrew Little as Health Minister to get us through this? Oh, I've been a public servant for 25 years. One of the things that's great about our public service is that we're independent. I've worked with more health ministers and associate ministers than I can remember, and they've all been incredibly committed to doing the right thing, and I've found them all very receptive to my advice in whatever role I've been in, and also really engaged with clinicians and those working in the sector. And I know this minister is equally committed and equally engaged. So, and he's been equally open to my advice on how to address the current challenges.
Okay, so areas that seem to have taken a bit of a backseat are obesity, alcohol, diabetes, things you're very familiar with in your previous work. We're told they could bring health to its knees. Would you like to see a plan on this, and can you see yourself working in those areas again?
Well, certainly outside of a pandemic, non-communicable diseases are the biggest killers in this country and the biggest causes of morbidity, hospital admissions and years of life lost. We read out the deaths every day from COVID, but our annual death toll from tobacco-related diseases alone is still over 4,000, 4,500 a year. It's phenomenal. There's still a lot of work to do. I think you've touched on obesity, nutrition, physical activity, and alcohol. Harmful use of alcohol has a huge impact on New Zealand society, a negative impact, and is a big driver of inequities and inequalities. There's still a lot of work to do there. I've had to focus on a communicable disease for the last few years, but my passion is still in that non-communicable disease area, so maybe another role contributing there in the future.
Okay. And you've been a bit cagey, I understand it, as to what's happening next. Is there any hints we might see you in Geneva?
Not so much cagey as honest, because there's genuinely no firm plan. I enjoyed my trip to the WHA in May, aside from catching COVID myself. And I've had the year there in the past and enjoyed working there, but I also really love New Zealand. I love working here, so I've just got a really open mind about what next. Yeah.
Have you kept any of the tea towels, hot sauces, Christmas decorations?
What I will say is my sister, who's quite a wag, has furnished the entire family with t-shirts or sweatshirts with my face on them, and they're all sitting in a pile unused. So obviously, maybe they'll become collector's items at some time in the future.
Christmas
you never
gifts, who knows?
Exactly.
You've been made an Honorary GP. Do you have any desire to become one?
Well, I did do some general practice as part of my training, and I have great admiration for them. And yeah, I'm really thrilled they've made me a sort of an honorary member of the college. I'm looking forward to continuing to work with the GP college and with GPs. I think they've got a really important role to play in the system. I have had an offer from a couple of practices to do some locum general practice, but as I said, I haven't done any clinical work for quite a while now, so I'd need very close supervision.
And is there any enduring moment of working with the Prime Minister?
One thing I would say is that, and I made this comment in my final speech at my farewell, that actually one of the things that the Prime Minister and I had to have was really a level of comfort with each other. So off screen, there was a fair bit of banter that went on, and I apologise to her for sometimes being a bit irreverent. So, I just have an abiding memory that before each of those stand-ups, we would spend at least an hour preparing and making sure we had all the right information and that our messages were really clear and consistent. So my abiding memory is a lot of hard work, and I guess I have a great deal of respect for how hard she works, and indeed how hard senior ministers worked and have worked through this pandemic to do the best for the country.
Right, and I understand today's your last sort of media round.
It is.
What's in store tomorrow? You just having a few drinks with the team?
Maybe at the end of the day, but yeah, I've got a really clear diary, so I'm just looking forward to walking around the building and chatting to people and hearing their stories and connecting, and just really having that final chance to talk to the staff. They're just such great people. Yeah.
All right, that is all we've got time for. Thank you very much, Dr. Ashley Bloomfield, for coming in and for your unwavering, I suppose, firm and clear communication throughout this pandemic.
Kia ora, thank you very much. And again, just to reiterate what I said yesterday, I think the media has played a really critical role in our success as a country. And I do want to thank them. It doesn't always feel comfortable when you're up there, facing the music, but it's a really important part of having a healthy democracy. And so I just want to acknowledge that and thank you and thank the media more widely for the work they've done.
Kia ora.